You know, every so often, something comes along that could completely rewrite the future of medicine. But what if the biggest breakthrough wasn't some brand new discovery, but just a new way of doing things? We're talking about a simple pill that is already making some absolutely enormous waves, and we really need to dig into why. So, just take a look at this number, 13.1%. On its own, it's just a statistic, right? But in the world of medicine, a number this big, happening this fast, well, that can signal a full-blown revolution. So what in the world are we looking at here? And there it is, that 13.1%. That's the average weight loss from a phase 1 trial for a new drug. And get this, it was achieved in just 12 weeks. To be perfectly clear, this isn't the final result after years of study. This is the starting pistol firing. Which, of course, brings us to the big question for today. We've seen some absolutely incredible advances with injectable medications lately. But could this be something else entirely? Could a simple pill really kick off a brand new era for treatment? To really wrap our heads around how groundbreaking this is, we first have to look at the current king of the hill, the drug that has already totally transformed the landscape of weight management.
And that champion is Wegovy, from the pharmaceutical giant Novo Nordisk. It's a super effective, once-a-week injection. It really did set a new standard for what was possible, but it also, came with a needle. Now, the new challenger from the very same company is a pill called a semaglutide.
Okay, and this is where it gets really, really interesting. In those first 12 weeks, the new pill, amycretin, delivered that stunning 13.1% weight loss. But in a similar trial period, the incredibly powerful injectable Wegovy showed about 6%. Yeah, that's more than double the effectiveness right out of the gate. This one chart just shows the mind-blowing potential we're talking about.
But look, as impressive as those numbers are, the effectiveness isn't even the biggest part of the story here. The real revolution, the thing that could change everything, is in the delivery system itself. It's the battle of the pill versus the pen.
And the difference is just stark. For a lot of people, the whole idea of a weekly self-injection is a major barrier. It can be intimidating, it can be inconvenient, but a simple daily pill, it just completely removes that hurdle. This shift alone makes treatment so much more accessible, and it could honestly attract millions of patients who were maybe a bit hesitant to start with an injectable.
And when you start talking about attracting millions of new patients, you also start talking about some serious, serious money. This isn't just a medical race, it's a flat-out economic one, with enormous stakes for the companies involved.
$100 billion. That's the projection for how big the obesity drug market could be by 2030. A number that massive, it explains everything you need to know about the intensity of the competition and the absolute frenzy to innovate in this space.
And this race is pretty much dominated by two key players. You've got Novo Nordisk, the makers of Wegovy and this new pill, amycretin, and their main competitor, Eli Lilly. Both of them are just pouring billions into developing the next generation of treatments, each one hoping to capture the lion's share of that $100 billion prize.
Now, this is what I find so fascinating. This chart, this is from Novo Nordisk's own market projection. They believe that by 2030, oral pills will capture over a third of the entire market. This tells you everything about their strategy. They know the future isn't just about injections, and they are racing to build that future themselves before anyone else does. So, with these unbelievable early results and a massive market just waiting, what happens now? Where does this really promising pill go from here? And what does it all mean for the future of treatment? Well, the path is clear, but it's going to take some time. That phase 1 trial gave us those headline-grabbing results. The next critical step, a much larger phase 2 trial, is set to kick off in the second half of this year. But we're all going to have to be patient, because we probably won't see the data from that until early 2026. And that's really going to be the make-or-break moment for this drug.
And this quote gets right to the heart of the strategy, straight from Novo Nordisk CEO. He says the goal isn't just to switch existing patients from an injection to a pill. The real goal is to get many more people to be treated. A pill isn't just a new product for them. It's a tool to massively expand the entire market.
And that leaves us with one final, pretty powerful thought. We've gone from having almost no effective medical treatments for obesity to powerful injections, and now maybe to an even more powerful daily pill. If this is what's possible today, what does the next decade of medical innovation even hold? I mean, really, what comes next?